People have basically heard all about the other joints in the body, the shoulder, the knee, the ankle, and now it's becoming more and more known about the toe joint itself. It is one of the smallest joints in the body, but in reality, it does take a good portion of your function when you walk. So that even as small as it is, if it's not properly functioning, you will notice it. And the compensation is going to go throughout not just your knee, but your hips and your back and to the rest of your body. The actual arthritic joint itself has no cartilage left, so you have bone-on-bone contact, and you can just imagine when you actually move the joint through its range of motion, that grinding of the joint causes the pain that most people feel. Most people that tend to see us for this problem are people that do have developmental arthritis into the joint, and it causes them to have pain with range of motion or even stiffness in the joint and alters their lifestyle. Joint replacement is what we use now as physicians to try to help with the arthritis and getting the function back, but it is something that it needs to be evaluated every time depending on the patient's age, activity level, and lifestyle, really. The joint replacement of the big toe is becoming more popular. This particular procedure has actually been done from early 90s. So it's been around for a while, but people haven't really known about it to choose that as an option. The previous standard of care was fusion of the joint, and a lot of patients are coming in for other opinions, second and third opinions. If you do actually think about fusion, fusion is elimination of motion. You put two bones together and fuse them, which basically makes them into one. If it's one, that means you eliminate the joint. If you eliminate the joint, there is no motion. Once the motion is gone, then the rest of your body or the rest of the joints surrounding that fusion have to pick up the burden of that lack of motion. And since the motion is not there, the other joints are more prone to developing arthritis. So now with this joint replacement, what we're able to do is replace that joint motion back to normal or close to normal as possible to prevent that. And it actually buys patients a lot more time and in their activities, in their function, in their lifestyle, as opposed to just fusion, which basically eliminates lots of activities. Over the last few years, I've actually seen the difference that it's made in people's lifestyle and the joyfulness of the patients when I see them that they haven't really needed to alter their activities because of a certain procedure. So I can preserve that for them, and that's really satisfying and fulfilling for me.